serious. Therapists, what is something people are afraid to tell you because they think it's weird, but that you've actually heard a lot of times before?
I work in an older adult service for people with dementia and mental health problems. I see a lot of family members, carers feeling ashamed of the fact that they are finding it incredibly difficult to care for someone that has dementia or a chronic mental health problem. Carer burnout is a real issue, and people need to know that it's not easy to see someone you love struggling every day or slowly fading away month by month. Carers and family members desperately need time for themselves and need to know that it's okay to feel the way that they do. No one is superhuman and we all have our own needs. It's why we have therapy groups for carers. It's okay to struggle to look after someone, and you should in no way feel ashamed of having those feelings.
That they hear voices. I've found that a lot of people aren't familiar with their own internal dialogue or self-talk, and that this is typically normal internal processing. A lot of people think that they are hearing voices and hallucinating. There are some pretty simple questions we can ask to determine if it's hallucinating or just internal dialogue, and most often it's the latter. Edit. I want to clarify that not everyone has an internal voice. Some have none at all. Some have more of a system of thoughts that aren't verbal, feelings, or images. That's normal too. Edit 2. Thank you for the awards. I don't think I've ever had feedback like that. Phew.
Intrusive thoughts about sex with family members or, in their mind, nymphomania as a result of childhood sexual trauma, and adult. Hypersexuality isn't often discussed as one of the PTSD symptoms, so people walk around with so much shame about it. Edit. Wow, I just looked at the upvotes and awards and want to say thanks, but truly the best thanks is to help raise more awareness and reduce social stigma so more people feel comfortable seeking help. Easier said than done, obviously, but it is also why I share my own experience.
Clients become quite fearful of admitting that they weren't successful since the last time they had a session. This could include not succeeding in using a coping skill that they're learning about, or not being able to complete a homework assignment I gave them. Humans aren't robots, and therapy is a lot of work. That being said, I don't expect people to be perfect as they start to work on themselves in a positive way. It takes time to really commit to change, especially in relation to trauma or conflicted views that an individual holds. I feel as if the client doesn't want to let me down as their therapist, but these failure events are just as important to talk about as successful moments.
Recurring intrusive thoughts about harming others can be hurting, killing someone, or sexual fantasies about children or relatives. Usually people take a while to admit those. The reality is that if you are having them frequently, you aren't dangerous. You probably have OCD and are terrified that you might be dangerous.
OCD gets misunderstood a lot. It's not just having a clean house or liking things to be organized. Common intrusive thoughts can include violent thoughts of harming children and other loved ones, intrusive thoughts of molesting children, fear of being a serial killer, etc. My clients can feel a lot of shame when discussing the thoughts or worry I will hospitalize them.
I'm a support worker, social worker, not a therapist. I've had clients too scared to tell me their accomplishments because they think they should only be bringing their problems to case management, and that if we see them getting better that we won't care/prioritize them as much. Another is hard drugs. We don't endorse it by any means, but we have to know if we need to keep an eye out for inappropriate behavior and overdoses. We never get mad at them for being high, we just want to send them to their room to sober up.
That they haven't had sex with their partner in years and don't know how/if they will ever have sex with their partner again. There is so much shame around sex in the USA that a lot of people are scared to talk to their partner about their sexual needs. Time goes by, and suddenly they haven't had sex in 3, 5, 10 years. It starts for a lot of people in their 40s and 50s. A lot of people, falsely, believe there is something wrong with their marriage because they fantasize about people other than their partner.
I work with a lot of anxiety and trauma clients. Whenever I ask if they would describe their experience as being anxious about being anxious, I get a lot of OMG, yes. Anxiety has such a physical impact in the body, heart pounding, trouble breathing, feeling faint or cold, tunnel vision, that we become aware of our body's reaction before we even notice the anxious thoughts triggering the reaction. Then we panic about why our bodies are flipping out when we're not even aware of feeling threatened, and the anxiety compounds on itself. Anxiety is like an alarm system in our bodies to signal the presence of real or perceived danger. What would you do if your alarm was going off at your house? Check to see if there's a real threat, scan your environment, situation to ground yourself in the present, turn off the alarm. Breathing exercises do help, along with mindfulness techniques like body scans, and then investigate what tripped the alarm. Process thoughts around the situation that read like danger to you. It's also important to note that danger doesn't need to be a gun getting pulled on you. Panicking during a presentation that could impact your job and threaten the way you pay your bills and afford your life can feel pretty dangerous if you think about it. Edit. I'm an anxious person myself, and I respond really well to learning, knowing more about an issue. If you're interested, look into polyvagal theory. It goes into great detail around the mind-body response when it comes to anxiety and trauma. Here's a YouTube video that talks about it in kind of a laid-back, TED Talk meets comic at a bar kind of way.
As someone in the substance abuse field, I know that it's difficult for clients to tell me they got high with a parent, but it's something I get told fairly regularly. It's kinda sad.
Some of the most common ones have been visual and/or auditory hallucinations and suicidal thoughts. I usually hear, "I don't want to be put in the hospital," or, "I don't want you to think I'm crazy." Also, basically anything sexual. I'm not going to judge you for being into BDSM, fetishes, etc. Honestly, I've probably heard it before and I'm not here to judge you. Same goes with any non-consensual experiences, especially if we're working through trauma.
On the flip side, I was afraid to tell my therapist about my suicidal fantasies. I was always told when you talk about suicide, people assume you're seeking some attention or special treatment or that they lock you up in a psych ward. When I finally brought it up, was told that's not true and a lot of people fantasize about suicide, it is normal. I felt silly for thinking I was weird.
Usually it's sex-related. Shame about their desires or kinks is common. Gender questioning is another. Some people are ashamed of things they did in childhood or adolescence, haven't ever told anyone and think the team will be horrified. We have heard everything. I'm always compassionate and always understand why we do the things we do. I've yet to have anyone bring something I can't get.
I'm beginning to focus on people experiencing prolonged grief. It's kinda cute when people come in and say, "I'm ashamed to admit that I still cry every day 5 years after my mom's death." That's why you're here. Then there's anything and everything related to sex. I had a patient who contracted a serious STD and didn't tell me for 2 months because they thought I'd be grossed out. Edit. Some people are taking issue with my use of the word cute. I'm not saying their grieving is cute, but the embarrassment. It's cute in the way watching a child learn a new skill is cute. The patient is learning how to grieve, and the way one fumbles through that exploration can be rather endearing.
Beep everything, dude. Everything. You name it, I've heard it. You regret having your child and wish you never became a mom? Okay. You love your spouse but their cancer came back again and you don't know how you can go through this fight again? Yeah, I get that. Hard drugs? Beep, it's been a hard year. You wanna quit your well-paying job to sell carved soap figurines? Okay, well let's talk through what that might look like. You like to collect teddy bears because they give you a special lil tingle in your nether regions? I don't kink shame. Seriously. We've heard everything. Unless it's someone newish to the field, less than 5 years maybe, it's generally not going to shock us. And whatever it is, even if it does seem a bit of a unique circumstance, we'll get the underlying feeling under it. In the end, everyone wants the same overall things: to feel heard, to be loved, to take care of their loved ones, to manage stress, etc. Humans do the best they can, and therapists are there to help, but we can't provide guidance if you don't give us a chance, and that means opening up. I know it's scary and some therapists do suck. It's a lot like dating. If you don't click with the first one, move on until you find one you do click with.
I'm usually more afraid that I'm boring them. Oh, you have anxiety about your normal job and normal family and we've been talking about it for a year now? Let's party. L.
Psychologist here. Basically, anything having to do with sex. There's so much shame. Sexual abuse. Sexual fantasies and fetishes. Erectile dysfunction. Infidelity. Becoming sexually assertive. I've been told that I have a good psychologist's face. I try not to have a strong reaction to normalize the discussion. With adolescents, they are extremely anxious to tell me if they've relapsed or aren't doing well. They cut one night or they were suicidal. They're having a lot of negative self-talk or panic attacks. They'll come in, pretending everything is okay. It's usually in the last 10 to 15 minutes that they'll say something. They'll reveal that they worried they'd let me down. That I'd be disappointed in them. It usually turns into a discussion about policing other people's feelings and tolerating emotions. I explain that I care about their well-being and it's my job to monitor my emotions and reactions, not their role.
Psychologist in the U.S. To name a few: compulsive masturbation, fears of being a pedophile/rapist, this is a common OCD fear, hoarding, sexual performance difficulties, history of sexual abuse or sexual assault, unfortunately it is very common, drug use, amount of money spent on various things, having an ASD diagnosis, going back to an abusive relationship, staying in an abusive relationship, grieving years and years after a loss, self-harm of all sorts, wanting to abandon their current lifestyle, for example, to have more sex, to escape responsibility or expectations, history of gang violence, crime, their sexuality or asexuality, gender identity, the impact of racism, racial trauma, paranoia, hallucinations, feeling uncomfortable in therapy, not believing in therapy, difficulty trusting a therapist, fear of psychiatric medication, fear of doctors in general. I was surprised to see suicidal ideation on others' responses. Most of my clients seem to talk very openly about suicidal thoughts and urges from the start of therapy, which I think is super healthy. I think that most of the people I've worked with had SI, current or history. As weird as it may seem, I can't imagine what a life without any thoughts about suicide would even look like. At this point, I don't recall a time a patient said something in therapy and I was shocked or even thought, oh, that's new. And emo, if you surprise your therapist, that is okay. I wonder if we asked Reddit, what are you afraid to tell anyone, even a therapist, because you think it is weird? How many people would see that they aren't that weird at all?
Honestly, most things. People have weird thoughts all the time and it's not as uncommon as they think it is.
That they resent parenthood.
Hidden sexual dreams and fantasies about family members. More common than people think, and often stays that way and doesn't really interfere in the person's close relationships unless they allow it. Many things we dream or think are unconscious and involuntary, and the root of such things is often nonsensical.
Hypersexuality after some sort of sexual trauma.
May your day be filled with joy and happiness. And please remember to like, share, and subscribe for more quality content every day.